I'm half asleep. I woke up at 8:15, took my dose, so I didn't even look at the bloody colour. I wouldn't have taken it.
Calm down. Just take your time.
Your weight was 73 kilograms in January, so you've lost 10 kilograms since then.
This monkey suddenly jumped on me and bit me on my right arm.
Oh my word.
Somewhere around here.
Walking along down the street, I was then waking up, like my brain had just stopped working.
Okay.
15, 20 minutes, whatever.
Just felt that life is worth living, you know. What's the bother? I'm not doing anything. I'm not, there's no life there. I'll never do anything about it.
Okay.
But it does come in my head.
You can hear it.
Your voice.
I lose it.
Yes.
I lose it. I've had it for 12 days now. When I've been at work, it really does come on strong.
Yeah.
Everyone calls me Frank, you know what I mean?
Good morning, final row surgery. Yeah, what's your date of birth?
Right there. Yeah. Not there, but there. You still don't do it the right place.
You have to put an X.
I'm going to put next.
Yeah. Do one, that's good.
Getting better.
Yeah. I don't need to see you till a fortnight.
Lovely.
I said I don't want to see you every week, but I'm sure you don't want to be up here every week.
I don't care. Somewhere to go. Face to see. Someone
I
to
love your
talk to.
blouse, it's lovely.
It's lovely, isn't it? £4 eBay.
Really?
I just thought 32, 34, that'll do me. As long as it covers my big swollen arms, I'm happy.
30. What sort of time do you want, darling?
Same time as now. It's
yeah.
super for me, yeah. But I told you I'm having the band, didn't I?
Yeah. Have you heard yet? No?
Well, yeah, I've got a letter through.
Oh,
but-
did you do it?
No, I don't know what to do with it.
Don't you meant to ring up and just tell him this Did you have like a password on it?
Yeah.
Phone.
So that's an assessment, is it?
Yes.
Say to me, you've got to lose a bit of weight, you've got to do a bit of this.
Well, yeah, because I might say you need to use a stone before you start doing it, or...
I'll tell you what, if I lose a stone before doing it, I won't do it at all. I never had a weight problem up until 10 years ago.
Really?
I was big as you. Never had no weight problem. Told you I was a stripper for years.
Really?
Yeah, I was a stripper for 22 years.
Oh, bloody hell.
I had a figure to die for. There wasn't anything out of shape, nothing wrong. Small bust, just hips to match. Lovely legs. That was my favourite bit, my legs.
Cian McLaughlin, please. Hello there. Come through. I've got a medical student with me today, if that's all right.
That's fine, yeah.
Good, good. Come in. Have a seat. Right. This is Cian.
Cian.
Now then, what can we do for Cian then?
Been sent here by the missus, really.
Uh-huh.
She just wants to get him checked up.
Okay.
He's been refusing food a little bit.
Right.
He eats all day.
He's a good eater normally, isn't he?
Yeah.
What about any diarrhea or anything?
I've got a picture if you want to see it. But
Go on, let us have a look and see.
I don't want to gross you out, but you can't really gross a doctor out right now.
No.
Right. That's what we got.
Yeah, OK, that's pretty mucky. Do you see that?
It's kind of like...
Can the student have a wee look and see?
It's kind of like rice pudding.
Yeah, that's pretty loose. When was the last time it was like that?
That was at about 9 o'clock this morning.
This morning, OK, fine. Just going to stick this in his ear and check your temperature, young man. Can you hear it? Beep, 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 beep.
Oh, boy.
That's grand. 37.3. Not too high at all. Let's see. So skin's good. I'll just feel under there. That's good. Ah, you don't want to. Can I have a feel of his tummy then? Hello? What's this? Put that there. What's that? Wow. Good boy. Look, put it there. Right. Yeah. He's almost, his tummy's okay, but noisy, but not just what I would expect with a bit of diarrhea and sickness. If he gets a temperature, a little bit of calpol, plenty of fluids, a little and often. If you find that suddenly he's got blood or anything in his stool, come back and see us. Okay then. Take care. Nice to meet you.
Thank you.
What is it? Above high five? High five. You do high five? Yeah. You're a rascal.
All right. Thanks very much.
Take care.
Thanks very much. Have a good day.
You too. Thank you.
Now we're all better.
Terence Burns, please. Hello, sir. Hi, nice to see you again, sir. How can I help today?
I've been having these panic attacks over the last month or so. I've been trying to just blow them away and think, you know, there's nothing wrong. But of course, what's happening, I'm waking up at 2 o'clock in the morning, not going back to sleep.
Okay.
I'm getting in the car, driving around just to try and forget everything. And that means I'm not sleeping, I'm not eating.
Okay.
And on Saturday, I was walking in a slough and I had another one of these dizzy spells. Nearly went flying all over. Luckily, I had my walking stick and managed to stay upright. Okay. But I just don't know what it is, you know.
So explain what happens when you get a panic attack.
I just feel lost and completely alone, and I don't know what to do with myself. Yeah. And I'm lying in bed and all of a sudden it comes over me.
Yeah. So it'll wake you up from sleep?
Yeah, and I've got to get up. And I walk around and I just feel...
Does it mainly happen at night?
Yeah. And it happened mostly at night, but it's been happening now during the day.
During the day as well, okay.
Yeah.
And obviously it's been getting you down. I can see it's affecting you kind of...
Yeah, really. You know, I feel really just, I don't know, just, you know, no energy, nothing to do. I was looking forward to retiring, getting out there and playing golf. And of course, the shoulder then went and I can't play golf, can't swing a club.
Sounds like actually the physical problems seem to be kind of bothering you the most here, and that if we could help you with that, then maybe this will help these episodes of panic. I mean, it certainly sounds like you are having panic episodes. That's usually the commonest cause for these types of emotions and feelings.
Yeah, I know that, you know. I always felt that, but I always felt I could get over it.
Yeah.
But over the last 6 weeks or so, it's just been getting worse and more.
Okay.
You know?
So I've had a read of the notes from... You spoke to a doctor yesterday, didn't you? So this sort of collapse episode. Yeah. So walk me through it. What happened?
Basically, I was walking along, this is in Manchester.
Okay.
I was walking along down the street. I was talking to somebody and then just, you know, I was then waking up. Like, no time had passed, no...
Yeah. You weren't aware of the kind of time in between, just found yourself on the floor?
Yeah, just found myself on the floor looking up at, like, the ambulance people and stuff.
Okay.
I wasn't aware of any nausea beforehand or dizziness or anything like that. It was just like my brain had just stopped working for 15, 20 minutes, whatever. I think I mentioned epilepsy at one point, and they were like, that's probably what it is. But it is different to what I've had before.
Okay. And what were your episodes like before? Can you walk me through a typical...
What I remember is usually like I'd feel sort of dizzy. I'd usually have time to like articulate something, like, oh no, I feel funny or something like that. And I'd be down for count. And I would go unconscious for a brief period, not very long though.
Okay.
And usually when I woke up, I would have vomited.
Okay. Can I just have a listen to your heart? And I just want to do your blood pressure and stuff as well. It's all right, you're all right. Okay, so there are two things going around in my mind.
Okay.
I think the first one is to find out whether this is something to do with the epilepsy that you used to have in the past.
Yeah.
I don't think that this is a simple faint.
Right.
Because often they get an idea that it's coming, they kind of get tunnel vision, sweating.
No, it's like I lost 20 minutes.
And the other thing is, it wouldn't have been for as long if it would have been, you know, a few seconds or minutes that you would have been out, not a full 20 minutes, right? The other thing is, though, when I was looking at your heart monitor, there's something about it that might link in with all of this. Most of it is not that worrying, but there was this thing about what's called first-degree heart block, which by itself I wouldn't have expected to cause any problems, but I don't know whether that's an avenue we might need to explore.
Right.
So what I'm going to do is I'm going to do a referral to the neurologist. The second thing is, we've got a GP here who's got an interest in cardiology. I'm just going to get him to scan this again and just give me an opinion as to whether he thinks we should go down that route as well.
Oh, sure.
So you will hear from me if that's the case. If these happen again, then I think it's A&E or coming back to us, depending on what it's like and how long it is and all that sort of stuff. But certainly make sure that we're aware if they're continuing to happen so we can expedite things if we need to. And I'm not going to start you on any medication at the moment.
Okay.
Is that all right?
Yeah, that's lovely. That's
Okay, good.
That's what I'm after.
Good. Take care, okay?
Yeah, thank you.
No problem. See you. Bye.
And what sort of things had you started to think about what you might try and do to kind of get through this? Was there things that were going through your mind?
Well, I hate to say it, you know, but I just felt that life is worth living, you know.
Really?
I sit sometimes there and think, you know, I'd never do anything like that. I'd never do anything about it.
Okay.
But it does come in my head.
Those thoughts that maybe it might not be.
Why should, you know, what's the bother? Why live, you know, because it's not, I'm not doing anything. I'm not, you know, there's no life there and, you know.
So it does sound like you've been quite down, and it sounds like there's symptoms of sort of panic and anxiety, but also low mood as well, or depression in another way.
Yeah.
There are a couple of things we normally suggest when you're feeling like this. The first thing is to consider a form of counselling, okay, where you speak to somebody to talk through how you're feeling, talk about your emotions, and maybe kind of build in strategies to try and deal with that.
Yeah.
The other thing is sometimes we consider medications as well. So antidepressants can help with these types of symptoms sometimes as well. They're not the cure, but they can, in the meantime, help with some of the symptoms. The other thing is there's a good resource, Age Concern. Have you heard about them? They have sort of centres locally in most towns. You're not alone in feeling like this. And there's lots of people in your position who feel perhaps that even some company sometime in the week would help to make them feel a bit more positive. And there are sort of befriending services and things like that that are accessible. That might be something to maybe look into as well. What I will do is I'll give you some information about the counselling. Again, it's not everybody's cup of tea. Okay, so what we could do is start you on a low dose of this tablet that you take at night. You take one tablet. There is obviously scope to increase the dose if we need to. But maybe we can give you that perhaps for a couple of weeks in the first instance. Bring you back, see how you're getting on with it. And then if there's no issues, you can continue them sort of on a longer term basis.
Never thought I'd be in this position, you know, where I have these episodes, you know. I've always been quite a strong person. But then I've always been active, you know, doing things.
We'll definitely walk right back to orthopaedics and try and see how we can best help you. Okay.
Okay, lovely.
All right, so we'll catch up again in 2 weeks.
Lovely, thank you.
All right.
Thank you very much.
Take care.
I like this. I want one upstairs. It's really squidgy.
It's easier, yeah. It's comfortable.
Yeah. Just put my head on it and have a nap every now and then.
Thank you very much.
Thank you. Bye.
How are you getting on?
Not too bad, a bit fed up with it all, but, you know, it's one of those things, it turned into an ulcer, and hopefully you'll be pleased. I was pleased on Friday.
Oh, it's not too bad.
Yeah, it's losing the gunge now, it's just got the blood, and she said, is that the new word for it, gunge?
Oh, dear.
Oh, it was itchy last night. Oh,
It was itchy around here.
It's the dead skin, isn't it, really? Oh, that's lovely. Do you know you're the only one that does that?
Cold water.
Oh, it's lovely.
Wash it with cold water.
It really is. It looks like it's getting some new skin there, is it?
Yeah, it's called granulating.
That's the word, granulate. I couldn't think of it, so I called it gunge.
Gunge. Is that what you meant?
Yes, I couldn't think of granulated, that was the word. I'll have to think of granulated sugar. My husband would be 80 today. Yeah, we're popping up the cemetery just to say our hellos.
Oh,
yeah, 80. Can't believe it. He would be 80 today.
Wow.
I'd like the whole getting married.
That's what my daughter wants to do.
Yeah, I like
She'd
that.
like to get married.
Yeah, no plans on having any kids yet. I like to do it the nice way, and I'm not going to say it's the proper way because people do it differently.
Yeah, of course.
No, I think it's nice.
the whole idea of marriage. Like, if you
It's
can make it work.
fashion again, hasn't it?
Yeah. My nan and
nobody's
granddad were married for like 47 years. Like, I couldn't imagine being with someone for that long. I'd want to kill him by daylight.
I want to kill them after 2 years.
You're with the right person, really. You went, wow.
How are you getting on?
Good.
Yeah? Good. When's your due date?
It's actually my birthday.
Oh, so, really?
So let's see how that
Both
goes.
my kids are born on New Year's Day.
Really?
So
No way.
Yeah,
Both?
random.
not twins.
No, they're 3 years apart.
Oh, yeah.
So I know that it's an odd. Things happen for odd reasons. Do you mind getting onto the couch?
Sure.
Yeah. Yeah.
Everybody tells me I'm really big.
Really big.
So I'm already starting to worry, but I think it's just because I am small myself.
Okay. It's more like a horse galloping.
A fast train.
Yeah, that's how you differentiate it from your own heart. Absolutely fine at the moment. Good. So I wish you well. It's one of the nice few times I get to see my own patients, well, you know, in antenatal as well. So it's good. So hopefully I might see you through the journey or afterwards.
Okay,
Yeah?
great. Yeah.
All
I'll
right.
try and get appointments with you. Sometimes it's a little bit difficult.
Yeah, it can be. You don't have to see me directly. I mean, we all work together, but
Yeah.
somewhere along the line we'll meet, I'm sure.
Okay.
Okay.
Yeah.
Take care. Bye.
Thanks a lot.
Lawrence Rooney.
That's us. Hi.
Come on in. Hello there, thanks
Hello.
for coming over to sit down there. How you doing? All right, so I think I'm looking at you after we did this ECG this morning, aren't I?
Yes.
And you'd seen Dr. Bulger about problems with dizziness, is that
Yes.
right? And then she said, let's do an ECG and some bloods and things.
That's
how are you feeling at the moment?
fine.
Okay, how's the dizziness going?
I'm glad to say I'm not. Now, I must admit, there are times when I do feel my balance is not right.
Okay.
But it's only hit and miss, you know.
Okay. So, a colleague of mine had a look at the ECG after it was done. I'm quite reassured. They're worried about a particular element on the ECG, which is one of these little small spikes here being a little bit too far away from the big spikes. But actually, it's just about borderline. And there isn't a pattern here that makes me worry that this is something abnormal, actually. So I was looking through your history just to make sure that it's not related to certain medications or problems with the blood tests and things, which it isn't. So I think this is what would be called a normal variant. So I will leave this with Dr. Bowler just to make sure that she agrees with me, okay? And then I think you just follow up with her routinely, if that's okay.
Yeah. It puts mind at ease. But as I say, like, there are times when I feel my balance is not right.
Yeah.
I usually get it if I'm bent down and come up. Usually when I get the dizziness, I sweat. Or the sweat just pumps out of me and my stomach is upset.
So the common thing is to do with changing position. Actually, as you get older, this gets more common, whether
Yeah,
you're a man or a
I
woman.
expect
And it's to do with how your body manages your blood pressure. So if you imagine you've got to get blood up to your brain, if you're standing up and you just left it to gravity.
No, I've got no brain, so that's no worry.
Oh, well, in that case, you've got nothing to worry about.
I was just so pleased that he's actually got a heart.
So far, you're in danger of having both the brain and heart, I think. But what I'm saying is that, you know, when you stand up, your body has to manage your blood to get up to your brain, because otherwise it will just drop to your boots. Yeah. And that mechanism can slow down a bit as you get older. So what happens is when you go from lying to sitting to standing, it might take a few minutes to catch up with itself, which is why you get that dizziness.
Yeah, well, I was always slow anyway.
Well, if you didn't have a brain, I sort of understand. But if you don't mind, I'll leave that. I think that's probably what's going on, but I'll leave it with Dr. Bulger because you've got that follow-up with her. But I'll leave the ECG to make sure she agrees with my assessment as well.
I'm happy.
And hopefully it will stay as you are, with both a brain and a heart.
Good.
Thank you.
Take care, okay.
Well, you don't meet many paddies with a brain anyway, so...
I'm not going to say anything. See you later.
See ya.
Bye.
I called you quite a long time ago, but you didn't hear me, so it's okay.
All right?
I won't do it again.
I'll waggle my finger at you. Naughty boy.
Why would I have to check in when you actually told me to come here at 9:40?
I've apologised for what's happened
No,
this
it's not
morning.
your fault.
No, but I am.
I'm so
I am
sorry.
sorry for what's happened.
It's because it's a cosmetic reason they've refused the funding. It has to be in exceptional circumstances for it to be removed.
They fund everything else.
Come in. I've got a medical student with me today, if that's all right.
That's fine.
Do you want to grab a seat? You spoke to my colleague on the phone.
Sorry.
That's all right.
Right. First of all, I don't like this surgery. And that's me being honest, okay?
Okay.
Look at the dose now. What's that telling you?
What am I looking at here?
You tell me, darling. You're the doctor, remember that.
Well,
You're the student as
I
well.
haven't seen you before, and
I know you
not
haven't,
here.
but this is why I've always said to them, I need my doctor that knows me and knows the files. You see what I'm saying?
I've had a look at your files, but I'm not sure what you're asking me to look at.
And I've just seen this now because I've just opened up my eyes. I'm having seizures yesterday.
Yeah.
Other epileptic people I've been talking to about this at meetings.
I'm not sure what you're asking me to look at.
Right, I'm asking you to look at the new dose that I'm taking.
Of?
I don't know how to call it. I don't know how to pronounce it. I suffer with memory problems. Sorry, babes. I'm not having a go at you. I've only just noticed it. So I'm saying, who's told them to change it? If it's written down as rules that doctors are not allowed to change something, but only neurologists are, why is it getting changed?
What is it that you think has changed?
Buravalakatakt. How do you pronounce that?
Brivac
okay.
It looks to me as if it's one twice a day. That's what it's.
What's the dose?
It says 100 milligrams.
Right. So who changed it?
One twice a day. It says I don't know until I have a look and see.
That's what I'm saying. So, then now
So what do you want me to do? Because are you coming about this or about your ankle and your
I'm
back?
coming about my ankle, but I'm saying, who do I go to when someone makes a mistake about the doses?
Okay, just bear with me.
I'm so scared now. This is why I'm having a panic attack right now. I'm sweating.
Yeah.
You know, I don't mean to be a human.
No. But
on drugs.
just let me. I have to come out and have a little look.
I've been having a seizure. Found in town, laying on my back. So I went boop on the floor, banged my bone. It's hurting when I'm sitting down. Can't go to the toilet properly. Banged the back of my head in Bedford town. This is Bedfordshire. The 2 children, luckily, the ambulance came, people standing all around me. And luckily my younger brother's dad saw me again because we just said bye to him and he saw me, ran over to the children, said, what's happened? They've had a seizure. She's unconscious still. The ambulance, I think they had tubes or things around me to help me breathe.
The last letter from the consultant neurologist that I can see from when you were discharged says 100 milligrams BD.
Yes, and when I rang up, what does the next one say? Because they always say this place, when they send letters, you don't get them.
Yeah, but normally we'd expect to get a letter of change and stuff.
And if you ring him right now and got through to somebody to say we definitely sent you a letter, I just don't know what to
So what are you telling me you should be on 175?
No, 75 twice a day.
75 twice a day.
This is the new dose they just put me on. I was an inpatient in March. I came out in April.
All I can do is sort of get in touch with them and try and sort out what they want you to
But
get
then
on to.
what I'd say is, what about this pharmacy? Find out who's made the mistake because they should have all my up-to-date notes.
They have been issued you what has been issued from here. So leave it. What you'll have to do is leave it with me because I'll sort out this problem and then we'll sort it out.
I think I should just try and get to Chalfont.
Well, no, we'll try and what we'll try and do is we'll ring them and see. I mean, I will speak to Deb and see what's sort of happening, and I will sort out get the dose sorted out then. We're not going to. This is a consultation about what's wrong with you.
So sorry,
No. What I'm going to do is I'm going to make an appointment for you to see the practice manager and discuss with one of the doctors. So you've got some time because there's a 10-minute appointment. Yeah, it's a 10-minute appointment. We're sorting this out. I can't sort out all the other stuff, and it is a little bit confusing. This was a complex consultation with Serena because she normally has a 20-minute appointment and only had 10 minutes. She was in a lot of pain and very agitated and upset because of the pain. I hadn't got all the information for Bedford Hospital about what had happened when she had her fall and seizure. And finally, she was given the wrong medication at the pharmacy again, which had upset her once more.
I know, I'm so sorry.
Listen,
I won't bring this to you.
Right, calm down. Just take your time. There is an issue. I will make an appointment with the practice manager and then one of the doctors to go through this with you so we can sort it out. In essence, our training does train us to look after people who will be very angry when they come in and may then actually hopefully feel a little bit better and less angry, upset, stressed when they leave.
Do you see why I'm so flipping angry with them?
You can see you're angry, but it's difficult for me because I can't. And you're asking me questions that I'm not going to be able to answer without going back and through things.
Be putting this on you.
No. Let me. Let me look at your ankle and your back and see if we need anything. So hold on to that. But I'm trying to sort of see what's.
Please take copies of everything and give it back to me, darling, because I don't trust this system.
Yeah.
They're making complaints about me. And they're forgetting that I'm the one taking medication. This is all happening all through the flipping years. I can't take it anymore. I've got children to look after. I want to get on with my life, and it's very flipping hard. I'm deciding to do, I just want to get off the flipping drugs. I don't like them.
Yeah. I can understand it, but let me just bear with me a second. I'm
not blaming you, babe.
No. I'm just trying to. Right.
Karana Bashi, please. Hello.
Hello.
Hi. Right, come and have a seat. My name's Julie. So, what's been happening to you then?
We were on vacation in Thailand. We were on the tourist island on a monkey beach, and this monkey suddenly jumped on me and bit me twice on my right arm.
Oh my word.
Somewhere around here where you can't see it anymore, and here where it's already healed a bit.
It's a bit better now. Oh. And so because of that, you're going to have some rabies vaccinations.
Yeah.
Yeah, and you've had 2 already?
Yes.
So this is your 3rd one?
I had one in Thailand and the second one in Indonesia.
Okay.
Up to 60,000 people die worldwide each year from rabies in the developing world, mostly in Asia and Africa. It's a really nasty infection that attacks the nervous system and the brain, and it is almost always fatal once a person starts to get symptoms.
So you're obviously very brave if you're having all these injections, aren't you?
The injections do hurt quite a lot.
Do they?
Yeah.
You must be used to these by now, are you?
No. You don't get used to needles.
No, okay. All right, just sit nice and still. I'll make a book. That's it, you're doing really well.
Ow.
Lovely, well done. That's it. All right, good job. Are you too old for an I've been brave for the nurse sticker?
He's 10, so do you want a sticker?
Are you too old for a sticker? Yeah, so I've got these ones. They're a little bit older. There's a monkey on there. You maybe not want the monkey, as it was a monkey that bit you. No, we don't want the monkey.
I want the whale.
You're going to have the whale. Lovely.
Thank you.
Okay, so that's mine. And, yes, and we'll see you in a week's time.
Okay.
All right, then. Okay, then. Bye-bye.
Bye.
So
notes of this, okay? Because you need to learn about this. If you can be a helper to people, then you could do a lot of help.
just a second, right? So going back, I can see where Dr. Ayer's giving you the 75s, but it's not on the system. I will get that sorted out so there's 75s, okay? You don't take 100. But what I can't see is why it was started on 75. That's
Well,
what
it's just given to me this morning. Every Wednesday, my every week dose comes.
Yeah.
So this morning, because I had the seizure last night, the aura, I fell down the pit. I'm half asleep. I woke up at 8:15, and took my dose. So I didn't even look at the bloody colour. I wouldn't have taken it.
Yeah. But in a way, it's supposed to give you more protection. And if you're fitting, then you would have to go to a higher dose. That would be normally what would happen.
Normally, but he said if it's not working, you have to come off of it. Have you read the side effects?
No, I haven't, but I'm
having headaches constantly.
So you're staying on the 75. Let me sort out the 75. But what I will do is listen. We can't deal with it in 10 minutes. I'll organise a meeting with the practice manager and one of the doctors to go through to try and sort it out.
You see how it's making me have more
Well,
seizures?
absolutely. But we haven't even looked at your ankle and thing, and we're now half an hour in.
I'm so sorry.
Let me look at this and see. Let's deal with it. And you twisted that at the same time or not?
I don't know. All I know is I was looking at the bush to think, should I go in there? And I went to turn around.
A sore here, is it? Okay, that's
It's
fine.
all at the front and under the foot now.
Sorry. Okay.
And under the foot. Because I can't put no pressure on it when I walk.
Okay.
None.
Okay, sorry. You're obviously very uptight at the minute, and the thing is, where you have bone, I'm absolutely convinced you haven't broken this.
Brilliant.
You have torn the little ligament here, the ATFL ligament. It's a bit bruised, but where you have got bony things, it will settle down. We will give you some. Are you taking any pain relief for it?
I just don't like painkillers. I don't like drugs.
You don't like. What you could do is put some ice on it, gently sort of try and move it up and down slowly, and use your crutch and put your weight through it as you're allowed to do if you don't want to take any pain relief. Okay. Shall I give you one off prescription for the 75
Please.
of the medication, and then what I'll do is I'll get somebody to sort it out.
Please.
Yeah. Let me just do the other one for now then. Okay. Let's try and get. I think it's worth getting you to a prolonged meeting so we can sort it out.
Thank you very much.
Okay.
At least you've understood that. Thank you.
Yeah.
I'm not a
Because 10 minutes is never going to sort it.
I know.
Okay.
Thank you very much.
So I will get them to ring you. Okay.
Thanks ever so much.
Okay. All the best. Take care. Bye bye.
Intense session. If anybody's got an appointment, you can use the self-check-in screen. It is easy. If I can use it, anybody can.
Katten for Tanya? You come through and have a seat. This is Halima.
Hello.
And how are you?
Not so bad. How are you?
Not so bad. Fine, thank you.
Recovering, trying to.
Yeah, you've not been well, have you?
No, it hasn't been a very productive 3 months.
Pancreas.
Yes, it's been very difficult.
Yeah.
So that's kind of.
Are you getting there, do you think?
Yeah, I'm getting there. Yeah. So
Good.
It's just got about 3 things at the moment.
Yeah.
Obviously, firstly is my weight.
Right.
I'm kind of concerned about my weight.
You've lost weight, have you?
You've lost weight.
Yeah. Yeah, I think you look quite different from the first time.
Yeah. I'm kind of concerned about as to what I can actually do to build that up, because obviously it's, I have to look at my stomach and everything.
Yeah. Because I saw you, well, it's back in February, so
Yeah.
it looks like you've lost a lot of weight since then. And then the other 2 things?
I need some more Creon tablets as well as Tramadol tablets as well.
Okay. Are they helping for the pain?
Yeah, for the pain, yes.
Pancreatitis is inflammation of the pancreas, which has 2 main functions. One function is to help with the digestion, and the other one is to produce insulin, which helps lower blood sugars. He's on some medication to help with the pain, and he's also on a medication called Creon, which will help with digestion. Did they ever find out what the cause was? I don't know if it was alcohol or steroids or anything.
Nothing whatsoever.
No, and you don't drink alcohol in excess?
No, I used to drink,
Right.
but I'm not in excess.
Okay. Well, so we still don't know what the cause is. And are they seeing you again in the hospital?
I've got an appointment with a gastroenterologist this week.
Okay. Right.
I've also got...
They're keeping a close eye on you, really, then, aren't
yeah.
they? It's difficult, isn't it? Because you can't eat anything that's going to cause your pancreas to flare up as well, so you're avoiding all the fatty things. But you're on the Creon, you said, as well. So that should help too. And then we need to make sure that we're still seeing you regularly. And we can check your blood tests anyway, but seeing the specialist regularly to try and find out what's happening and why you're losing weight and why you've had the flare up of the pancreas as well.
Okay. I just want to find out how I can build up my weight as well, because I'm kind of concerned.
We'll check your weight today, and then I'll see what we've got from the past with your weight. Okay. 63 at the moment.
63,
Yeah.
I've been cutting out all the sugar and stuff like that.
Yeah.
I'm eating all that, all the pastas and brown pastas and stuff like that.
So your weight was 73 kilograms in January, so you've lost 10 kilograms since then.
Come and take your seat.
See what it is? It's I play golf, it doesn't hurt. But there, I can't lift it anymore.
Pop this off and pop your shirt off.
Okay.
Let's do a few exercises.
Okay.
Up we go.
There you go. So, there you go.
I really caught it there. Can you push it further past that? Don't just slowly.
No.
Okay. Nice and relaxed. Just let me move it.
Yeah.
Okay.
Ah.
Okay.
Yeah. Yeah.
Okay. 2 beer cans. Hold them out like that. Okay. Move them out a bit like that. Okay. Tip them out. Push up against me.
Yeah.
Okay. So you do. So you've got. This is it's called impingement. Okay. So your shoulder joint is a ball and socket joint. Okay, so you've got a ball here and you've got a socket. The socket's really shallow, so that means it's really an unstable joint. And it's held together by 4 very big muscles that hold it in place so that it doesn't move too much. Now, for whatever reason, either the muscles get a little bit weaker, or maybe you've hurt them slightly, or whatever. Who knows? But that allows this to move around a bit further. Okay, and then that starts bashing into the things that are in there. So there's fat pads that are sitting in there. There's other tendons, and these can become inflamed. So, what can I? Yes, I can do a steroid injection to allow it to settle some of that inflammation down. And I'm going to give you some exercises. So how often do you get out to play golf?
Once a week.
Yeah?
Once a week, yeah. Once, twice a week, do you play golf?
Mate, years ago when I was in Australia, I used to, because I sort of did a shift pattern then, but now, if I had played golf, my wife would kill me.
What's that? So do you think this will heal up, or is it really...
I'm hoping so. Prick now. Just put a bit of that over the top. Okay, mate.
Thank you very much.
I saw you in February and you look noticeably different.
Different, yeah.
Yeah. It might be because you've been unwell, you've been in hospital, you've not been able to eat properly.
Yeah.
But I think, sometimes with the pancreas, you can get more worrying things, can't you?
Yeah.
So we need to get those checked and make sure that we keep monitoring you and finding out what the cause could be.
Yeah, of course, yeah, so...
Katan has had some significant weight loss, and this is always concerning to GPs. I believe that his weight loss is because his pancreas is not functioning properly to help him with digestion. However, we always would need to exclude something more sinister like pancreatic cancer, which also causes significant weight loss. And I'll give you the sick note as well.
Thank you.
So it's until the 30th of September, and then if you need a further one, if things are still ongoing, then come.
I'm still looking for a job as well, so I can kind of... I want to try and get this sorted out, because obviously...
I know, we've got to think about health first, haven't we?
Health first, yeah, so if I want to go back to work, I'm looking at acting...
What did you used to do for work?
I'm an IT consultant.
Okay.
So I want to go back to work, got bills to pay, got a kid going to university in September as well, so...
Okay.
So when I get back in...
All right, so that's your sick note. You've had one before, so yes, you know what you're doing with that. That's the tramadol, but the other prescription for crayon's gone to the chemist. And if you could book in to have your blood tests whenever you can as well. And they're just routine tests, non-fasting, so whenever it's convenient for you.
Okay, that's great. Okay, thank you very much, Doctor.
That's all right, nice
Cheers.
to see you.
And you as well. Thank you very much for seeing me today.
Take care then.
Cheers.
Bye-bye.
And you as well. Have a good day.
Bye-bye, you too.
Thank you. Have a good day.
Bye.
How are you?
Yeah, all right, thanks.
Good. How can I help?
You can hear it.
Your voice?
I lose it.
Yes.
I lose it. I've had it for 12 days now.
12 days, gosh. Does it hurt?
It don't hurt, but it gets worse. And I literally trying to speak to people, and I'm like, this is the best it's been. Because I ain't spoke. I've been sitting all day. When I've been at work, it really does come on strong.
Yeah.
Everyone calls me Frank, you know what I mean?
So did it start with a cold or anything?
No.
No. Okay, let's have a quick look at you then. I'm just going to take your temperature. Okay, that's all right. Do you smoke at all?
Yeah, I smoke and I have a drink as well.
How much do you smoke?
20 fags a day.
Okay.
And I vape. I've been vaping as well.
Okay.
I did sort of knock it on the head for a little bit, and then I started smoking again.
You tried to give up smoking there, look.
Yeah, I know.
2010.
I had the tablets then, I think it was.
Did they help?
They helped a little bit, yeah. Can I do that again then? Yeah.
Yeah. Would you like me to prescribe you some?
Yes, please, yeah.
Because that would be really good if you could start that now, because your voice would probably get a lot better.
I've had a lot going on as well. You know, I'm going through a divorce and everything. That's why I sort of started smoking again, because it's like not a very good one. Do you know what I mean? There's a lot involved. It's worrying me a bit.
Put your mouth wide open for me. Oh, it's quite red in there, isn't it? You said it doesn't hurt?
It doesn't hurt, no.
Have a listen to your chest, all right? Do you want to just put behind a curtain? It's a big tattoo.
Yeah, I've got to get it finished.
Yeah. Okay,
There's a few squeaks in there, OK? Put your shirt down again and you can... Because your throat is really, really red and swollen, I'm going to give you some antibiotics because I think it could be all due to infection. So if your voice hasn't come back in a week, then we need to be sending you off to see an ear, nose and throat specialist, OK? Is that all right?
Yeah, that's lovely. Thank you
All
ever
right.
so much.
OK.
All right.
Good.
Cheers.
And
Thank you.
when we see you next time, you won't be smoking.
No.
Good. Take care.
Thank you.
Bye.
Cheers. See you later.
Yeah.
Take care.
Okay,
Bye-bye. Okay, not at all. Take care. Bye-bye. Bye.
Okay, thank you very much, Dave.
Okay, mate.
All right, thank
Take
you
care,
very much.
okay, see you.
All the best.
All the best.
Cheers.
Okay,
All the best.
bye-bye.
Have a good day.
Phones are a bit quiet. Sorry.
Don't say that.
Oh, that's it then. I've jinxed us all. Hello, Fine and Rose Surgery. Nikki speaking. How can I help?
Come in, come in, come in, come in, come in. Oh, look how beautiful. And this is Grandma, yes?
Grandma is my grandma.
That's your grandma?
No,
No, it's your mother. Oh, thank
Yes,
goodness.
grandma,
I was about to say, you look really young for your grandma.
My mum, yes. It's my mum.
Fantastic. Take a seat there, Mum. Now, let's pop her out of here, onto there,
Okay.
and strip her down, but leave her nappy on, please.
Okay, okay.
Okay.
That's all right.
And we'll have a chat. How are things going?
It's all right.
All right?
She's good.
First, second, third, fourth, fifth baby?
No, first my baby.
First baby?
First baby. I'm
Wow.
43. Doctor, it's like...
43?
Yeah, it's like $1 million for
$1 million?
Maybe more.
Jeez.
Uh-huh.
Wow. So you're a very happy mum.
Oh, yes, I am, doctor.
Are you getting any sleep?
Sometimes it's problems. She have a problem with poo, actually, you know?
Does she? Yeah.
Yeah, sometimes 2-3 days.
Breast or bottle?
No, now bottle, because I getting flu, so I have to take medicine, and after I stop. I know, doctor.
Well, do you know, it's not unusual for babies to have, to have a cycle sometimes, which may take several days.
Uh-huh.
Does she really strain when she wants to go?
Yeah, it's very...
And is it very hard,
Yeah,
the stool,
hard,
when it comes
hard,
out? Okay, we might give you something just to try and help
Okay,
that. Lots of hair.
Yes, she does.
So there's the fontanelle, that's the soft spot up there, that's good. Well, let's have a little look at your ears, so plenty of cartilage there. Let's have a little, I'll feel these ones now. Now this is where we see how strong she is. Oh. And you're going to lift that head? Come on, lift that head up. Whoa! There we go. Oh, now look at that. She doesn't want to let go.
Oh, yes, yes.
See, my children now 18 and 16, so they haven't needed this. Yeah.
So you forget actually how to put it natural.
I can still... No, I remember how to do that. Hit good. Now, this is the last one, OK? So this is the one that mums hate.
Okay, that's
This is called the startle reflex. And we sort of keep it there nice and then we go, whee, and she startles.
Oh, yeah, yes. She always do like this.
That's good. OK.
So it's all right?
Yes.
Huh?
Perfect.
Perfect.
Do you want to put the clothes back on? OK, so that's good. So it was a normal delivery or was it cesarean? Normal delivery? Good. OK.
Yes.
Any problems since then? Ween, passing bowel motions?
Yeah, problem with the wee doctor.
What happens?
How I can coughing.
And yeah.
It's
Okay.
gone.
So do you know what you need to do with that?
I'm exercise. because
Pelvic
the nurse
floor
asked me to.
exercises.
Yes,
Yeah.
I did, but it's
Really
still
important.
happen.
It means you need to do it more and more.
More and more.
Okay. And it's hard to remember to do it all the time.
Okay.
My mother-in-law
Okay.
used to, every time she stopped at a red light, it would just remind her that she would have to do her exercises. So she'll be in the car doing this, you know.
Yeah.
But you've got to remember to do it. So you need to make real effort. You need to do it all the time because you need to firm up those muscles again.
Yes, I did.
Okay.
Because I was absolutely.
That's a built-in babysitter. That's great.
Yeah, that's great.
That's for you.
Okay.
Okay, so you just need to go and wait again for the nurses so that they can do the immunisations, okay?
Okay, doctor.
Good luck.
Oh, thank you.
I'm sure you'll be fine.
Thank you, doctor.
Mum's here to help. She'll be
Yes,
fine. She's
yes.
been through this already.
Yes, she is.
Well, look how big you are now, see? She must have done a good job.
Oh, yeah. Thank you so much for your help.
You're more than welcome.
Thank you. Bye-bye.
Bye-bye.
Nice to see you. So, firstly, thank you for having the blood test done. The results have come back and it's looking pretty good. All right. So we wanted to do the special checks of your memory today, Patrick, if that's all right. Yeah. Patrick came in with his wife on this occasion. It was his wife who was concerned about memory changes. We decided to conduct a memory test. It tests higher functioning, things such as memory, so recall, and visuospatial functioning as well. Shall we make a start? Yeah. All right. Now, the first thing that we're going to do, I'm going to give you a name and an address. After I say it, I'd like you to say it, and then remember it, and then we'll do some other bits. And right at the end, we'll ask you to give me that name and address again, all right? So, here we go. John Brown, 42 West Street, Kensington.
John Brown, 42 Kensington Street. No, 42. Gone.
Leave it.
That's all right, that's all right. Stick with it.
Yeah.
Do you want to say it again?
Yes, please.
All right, I'll say it one final time.
Yeah.
John Brown, 42 West Street, Kensington. Over to you.
John Brown, 42 Kensington Street.
Right, you've got to remember that at the end of the other ones, all right?
All right.
No, I still don't go there.
OK, all right.
Don't worry about it.
I'm not worried.
What's the date today?
19th.
What month is it?
August.
Yeah, and what year?
2015 or 6. No, 5 is 6 comes in it.
All right.
Which one is it, Patrick?
So, how's things been then?
All right.
Yeah?
Yeah, I'm quite happy with the treatment I've got.
All right, good. And no problems with your chest? No,
No.
nasty chest infections or anything like that? Okay. And so we need to do your blood pressure, so we'll do that.
I always get nervous when I have my blood pressure taken. I don't know why. It's stupid, isn't it?
Okay, that's not bad at all.
Oh, isn't it?
No.
Oh, good.
What was that, 144 over 67.
Oh, everything's okie-dokie.
Yeah, so are you coughing much?
Not really, no. I did, but a while ago, last time I came, didn't I?
spasms now and
I did
again.
last time, and she said I hadn't got an infection because she tested me, but I'm all right now.
So you don't cough on a daily basis or bring up any phlegm on a daily basis?
No.
Might have a tickle, like, you know.
Just more of a tickle.
Yeah, but I'm all right lately, am I? Better.
Do you manage to do everything you want to do? So sort of, getting dressed, bending
Oh,
forward.
yeah, no problem with that.
That doesn't make
No,
you
I
breathless.
hoover and everything else.
Sorry?
I hoover.
You hoover? Oh, good.
And change the beds.
all at the time, but, you know,
No,
as
well,
a
I do all
rest.
downstairs and then upstairs. And I change my bed and that.
It's only this year she stopped mowing the lawn. She doesn't do
I've got a gardener now that comes and does it.
Excellent. So for 91, you're doing really well, aren't you?
Yeah.
Beryl, you seen a nurse today or a doctor? Nurse speak for you?
It's just kind of going.
Go on, I'll find you somewhere.
Is that right?
Go on.
Thank you, darling.
See you in a bit, darling.
Thank you, darling.
What we're going to do now is I'm going to draw a circle, and I want you to think of this circle as a clock face.
Yeah.
Can you draw in for me the numbers that you would expect to see on a clock face? Lovely, thank you. And now what I would like you to do next is, can you draw in the hour hand and the minute hand so that the clock reads 10 minutes past 11 o'clock? Fantastic. Well done, thank you. And now, back to the name and the address that I gave you right at the beginning.
John Brown.
Yes?
I don't know, can't remember the number, but it's West Street. We go further, isn't it? It must be 2016. 2016.
Okay. Fine. Let's have a look. Let's total your score up. That's all the bits that I need to do with you. Thank you. OK, so that's not such a bad score, actually. Memory loss doesn't necessarily mean you have a diagnosis of dementia. There are many other reasons why somebody's memory could be affected. As GPs, we would be looking for the reversible causes, so physical conditions, which may include things such as problems with a person's kidneys or their liver, thyroid problems. Could the patient possibly be having an infection? Things which are treatable, which are reversible. OK, over to your wife. Some questions here. Would you say Patrick has more trouble remembering things that have happened recently? Yeah. Does he have more trouble recalling conversations from a few days ago? Yeah. And when he's speaking, would you say he has more difficulty finding the right word? Yeah. OK, so...
Gets very tired in the afternoon.
Right.
Very tired.
OK.
Sits down like that, and it's gone.
Right. So, in terms of the memory, that's what we wanted to kind of focus on today. It certainly looks like there might be some changes occurring to the memory. How would you feel about having it further looked into by a specialised memory clinic?
Yeah.
Local.
It is local. They can do really thorough assessments for patients.
Yeah. OK.
All right.
Thanks ever so much.
You're welcome.
With our regard to John Brown.
I will do. I'm really glad you remember that one. That's good.
Good.
Well done. Take care, guys.
All right, thanks a lot. Bye.
Ladies, whatever you do, don't fight over me.
I'm sorry, I'm just in the middle of doing something.
I'm thinking one of them's going to give me the eye in a minute.
If we don't put the note on at the time, we forget, and then that's it.
Of course.
Don't remember to get 2 bags. Otherwise, you've got to remember to get 2 bags, as you won't get one.
Alan Tilbury, please. Hello, I'm in here. Come and have a seat. Right. Is this about blood tests, yeah?
Yes.
Diabetes, yeah?
I've got on well with that tablet.
It's down a little.
Well, it would be, because it's working.
I think that might be overstating the case. Yeah, I mean, it's moved from nearly 100 down to 93, so that I really can't say that it isn't moving in the right direction. It's nowhere near where it should be. Yeah?
Yeah.
So what we need to do, as always with the diabetes, is a plan, yeah?
Yeah.
I think that there are two options. There's the option that says that the gliptin has had a little bit of improvement, so maybe we should give it a bit longer.
Yeah.
There's the option that says the gliptin has helped a little, but you're still quite a long way off target and we're running out of options.
Yes.
So do we think about insulin?
Right. I don't want to go on to insulin.
Mm-hmm.
I have to admit, I haven't eaten the right things.
Okay.
Yeah.
So you
I've
think
eaten sweets.
He's cut down,
chocolates,
but still eating.
biscuits.
So your diet could stand a bit of improvement.
Oh,
Am I being polite?
A radical
and you see,
improvement.
it's that which is up here,
Okay.
and I'm thinking, you're a bloody idiot. If I'd have cut out the thing and done the test, like we've done now,
You think it would be
I
better?
would have had an entirely different reading.
Okay. So the third way is that you stay on the gliptin,
Yeah.
but that you work really hard on your diet.
Work a bit hard on it.
Is there anything I can do to help with that? Do you need to go back to the education?
Gaffer tape his mouth?
I can't do that, not on the NHS.
I let you.
No, believe me, I'd end up on the front of a paper somewhere.
It's me up here.
How can I help you?
I done the blood test yesterday.
Okay.
I don't know what's happened to me. You scared me. Is something wrong?
No, it's just it looks like you're very anemic.
That's why I'm feeling dizzy all the time, feeling tight, feeling sleepy, feeling,
Yeah, absolutely. You would be with the anemia of that degree. Any shortness of breath at all? Are you short of breath?
Yes, lots. Even when I'm talking, I can't keep it up talking because I feel like...
Let me just do your blood pressure, okay? And your periods aren't heavy?
Sometimes heavy, sometimes normal. Is it red, is it normal?
So we're back to do you need any help with the diet? There's an education service run out of Upton where they give advice about diabetic diets, lifestyle education. Or do you know what you should do and you just need to do it?
He knows what he should do. He just needs to apply it.
Yes, I can tell you exactly where
you're going wrong.
Chocolate-coated peanuts.
I should get your diet sheet out again and pin it on the fridge door.
Okay,
I've still got my diet sheet.
So essentially you don't need me to get you any extra help.
No, it's me doing it.
We need a plan. I would have thought that the sensible plan would be to keep you on the pills you are on.
You say to me, Alan, next time you come here, I want to see that weight down. Yeah.
And I need to step up in the mark.
Say that to me, yeah. And that's be my job then to get that weight down.
Okay, well, that's exactly what I want you to do. I want you to get your weight down. So, the same medication, but why don't we say that we'll give this, 3 months? That's how long the blood test takes to change.
Yeah, that's fine.
I think that if at that point it's still running too high,
then we know.
Then insulin, I think, is probably the only way to go. Are you okay with that?
He just wants to know he's tried all avenues.
Which I think is fine. Now, if anything changes and you want to revert to let's go straight to insulin, you get in touch with me or Dr. Allen, yeah? Does that work for everyone?
Yeah, sure.
Happy with that?
Yeah, that sounds good.
Lovely. You can escape.
You tried.
With no chocolate peanuts, yeah? Go.
Thanks very much.
Bye-bye.
Thanks very much.
Bye.
Did you suddenly start to feel more like this, or has it been a slow thing?
No. Yes, slow. Yeah,
Okay.
I think it's a sense of 1.5 years now.
Do you lose any blood from your bottom at all?
Just a little bit, sometimes, not all the time.
Not all the time. Any tummy pain at all?
Where?
Anywhere on your tummy?
Yeah, sometimes here, sometimes. Yeah.
Can I just feel your tummy? Is that all right? Put yourself up here. And do you take any medications like Ibuprofen or anything like that?
Oh, yeah, Brufen or Anadine, yeah.
How often do you take those?
When I feel headache or something like that.
Is that most days or?
Yeah.
Put yourself up there for me. Just going to feel your tummy, all right? So where do you get pain if you get pain?
Not pain, just not pain, just when I feel tight, it's my body, my body hurt.
Okay. Okay, finish. Get yourself up. Oops. Let me just explain. It's the haemoglobin in your blood that's low, okay? Normally, the normal range is 115 to 165, and yours has come back as saying 54, which is very low indeed.
Carmina Puyu. This is Holly, who's a medical student sitting in with me this morning, if that's okay. How can I help?
Sorry about my voice.
Yes.
I have a very bad cold.
Yeah.
But this is not the worst thing.
Yeah.
I was abroad in my holiday,
Mm-hmm.
and I'm afraid I got urinary infection.
A urinary infection.
Yes.
Yeah. Mm-hmm.
I have a very bad pain when I'm urinating.
Right. Burning or?
Very,
Mm-hmm. Mm-hmm.
very bad.
How long has that been there now?
Since a week.
Okay. And did you get any antibiotic treatment for the urinary infection?
Yes. I had with me ampicillin.
Okay.
The problem is I still have the pain.
So you have the pain. And how many days ampicillin did you have?
So since Monday, I have a week now.
All right, okay. Mm-hmm. But no better. Okay. And is the pain in the urethra where the urine comes out, or is it in your lower abdomen, your pain?
When I'm urinating, that feeling, feeling the bladder full, that specific pain.
Yeah.
And I feel like I need to go to the toilet every 10 minutes.
Did you bring in a urine sample with you?
No, not yet.
Can you do one now?
Yeah, I
Yeah,
can.
we'll test it, yeah. If you pop next door and just do a sample and come back, we just, so you just want to dip test it first. Yeah.
Let me just explain. It's the haemoglobin in your blood that's low. I imagine that this has become so low very slowly, because otherwise you would be, if your blood count suddenly reached that level overnight or over a few days, you would be very unwell. You'd feel very short of breath, but you've compensated because it's happened slowly. So I'd like them to see you at the hospital. Is that okay? Yeah. Would you mind waiting in the waiting room then, and I'll just make that phone call. All right. Okay, thank you. All right. Sit close by and I'll come and get you in a second. All right. Oh, hi, is that ambulatory care? Hi, it's Dr. Marsh. I'm a GP in Slough. I was wondering if you'd see a lady who's 41 for me. She had some blood tests done and she's been found to... Well, her haemoglobin's come back as 54 and the blood count also shows that her platelets are a bit raised, so she must be losing blood from somewhere. But if that's a real result, then I'm a bit worried about sending her home because we don't have far to go if she were to bleed anymore. OK, that's really kind. Thank you.
So I want you to take this antibiotic called ciprofloxacin twice a day for a week.
Do you think it's needed to see a specialist?
If we referred you on the NHS, they wouldn't see you for something like this. They need us to go through the pathway. So the pathway is to find out what the organism is, treat you first, find out what the organism is. If it comes back as another set of antibiotics, we might need to change the treatment. And then we need to review you and see whether or not your urine is continuing to be clear. If you had recurrent urinary tract infections, depending on the culture results, then we would treat you preventatively. If you got another infection, then we would refer you, and then they would accept the referral from that point of view. They won't accept a referral out of pathway.
Okay, it is any difference on the... if I'm going to the private specialist? Because also they need a referral from here.
You could go yourself to a private GP and get a referral, but there's no medical grounds to refer you at the moment. We haven't done the basics. And to refer you without doing the basics, it wouldn't be a high-quality intervention. It'd be a low-quality intervention.
How would I know the result of the test?
You can ring in, or if that's abnormal, I'll be ringing you.
Okay.
So that's what we'll do, and then we'll see what the culture grows, and then we'll advise you. Okay? Okay?
Thank you.
You're welcome. Bye-bye.
Hello, Ollie. Let's go back in. So I've just spoken to them, and they're really happy to see you at the hospital. Okay, and they'll see you via A&E. So if you go to accident and emergency, someone is expecting you. Okay, I would go straight there.
So is this like a really serious? Because she's quite worried. She wants to know like.
Well, we don't have any answers at the moment because I've not got any idea really why you may have lost so much blood. I sent you to hospital because it was likely that there was internal bleeding from somewhere in the gastrointestinal tract, but I couldn't tell from the history where this might be. So I needed some more investigations. But don't worry, okay? Yeah? You're in good hands and we get this done as soon as possible. Without you coming to any harm because of the low blood count. So there's someone's expecting to see you. A&E. Is that okay? Take the dresser with you. All right, try not to worry. But it's a good job you came in when you came in, I think. Okay, come back and tell us how you got on. All right.
All right, thank you very much. Thank you. Thank you. Bye-bye.
Bye. Bye.
And with being 17, it's got a decent aircon.
It does. It smells nice.
Jim's room's got a decent aircon and smells nice, though.
Jim's room always smells really nice, actually, thinking about it. What does he do? He must use about a bottle of air freshener every day. Spraying that room down.
How can I help?
Well, it's about my rib. I had a very, very painful rib yesterday. It was very painful. I could hardly move properly.
Yeah.
So I think what happened is the day before, I was doing some heavy lifting at the allotment. I've got a 5-gallon drum for water.
Yeah.
And I lifted that and a watering can.
Yeah.
And I think that might have done it. So
Right, yes.
It was quite worrying, though. It was
Sure, yes.
quite painful.
Yeah, step off your top. So just show me where it's hurting you.
About there.
Yeah.
Just about there.
Okay, so if you could put your finger on the most tender spot.
Yes, I was saying around about there.
There, okay, so let's just have a look, yeah. You're tender there.
Ah, yes.
That's tender.
That's it, yes.
Can I write on you?
Yes. Yes, I think you're reaching it.
How are you here? It's tender there as well.
Yes, it is, yes.
You're okay there?
Well, I can feel it, but not as much.
Not as much, okay. Right, so can we just lie over here? Okay, just get yourself comfortable. Deep breath. And out. If I'm pressing there, is that okay?
It was then, yes, yes. It's quite painful. Yeah, oh, yes.
Sorry.
Hello, mate. I'm all right. Sit yourself down there and we'll get stuck into your acupuncture and then you can tell me what else you wanted to talk about. 14, 20 and 21. How have you been?
Probably the last 3 weeks. It's been quite painful. I needed to get in to see you because the treatment does work perfectly.
Good, okay.
How you been?
Yeah, I've been fine, thanks, mate. Well, in saying that, I ended up in hospital at one stage. But,
Oh, really?
Yeah. But outside of that, yeah, been good. There's a spot here somewhere, isn't there?
Yes.
Tell me when I hit it. Good, okay, mate. Don't go anywhere.
No, I won't.
I'll be back. Did I tell you the story of when I once saw a chap and because I had to stick him in a different room and I didn't, so I dashed in, stuck them in there, and the way it was put on the screen, I then forgot about him. And that was about like 3 o'clock in the afternoon, and I went home at 6.
No.
My partner rang me at about 6. He said, "What do you want me to do with that chap you've got in in room 5. I said, "Oh, please pull out his needles and apologise." He did say it was the best acupuncture session he's ever had. I'll try not to do that for you.
So what I think you've done, I don't think you've broken any ribs, but you have some tenderness over the ribs. Most of your tenderness and pain is coming from the muscles between the ribs.
Oh, I see.
Now, these muscles hold the ribs in place. So even if you had fractured a rib, we don't do anything about it because they're held in place and they just heal up. It takes 6 to 8 weeks to do that. But it's the muscles between your ribs that are strained. And I think it probably had to do with that lifting. Because when you lift something away from you, particularly, your muscles have to work hard to splint your chest. And in working so hard, they sometimes tear little muscle fibers and they burst and they liberate their contents, and the immune system mops that up. And that's what causes the inflammation. But don't worry too much about it. It doesn't indicate that there's anything serious. It's just a consequence of an injury, like a sprain.
Yes.
You could help it by putting ice on it, and I give you a gel to put on it that might help a little. So ice and gel.
Yes, okay, I will. All right, thanks very much. Thank you, Doctor.
Yeah.
Very good.
Yeah, nice to see you.
It's quite boring, isn't it, this therapy?
Yeah. It's nice though, because you can relax.
Well, you can, yes, that's true. So, Colin, I might get you back in a couple of weeks. Is that reasonable?
That would probably be spot on.
Yeah.
If you could do that.
Yeah. I'll write it down for you. Good. Fantastic. Okay, mate, they're all out.
Lovely, thank you.
It's your next appointment, so we'll see you then.
See you then.
And hopefully a couple of these, will, we might get there again.
Yeah, I think so. Thank you very much.
No trouble. See you, mate. Bye-bye.
Isn't it? Yes, come in, take a seat. Do you want me to talk or you?
Yes, please.
Okay. So we come today because she was on antipsychotics.
Yeah.
Oh right, she's come off them herself.
Right, okay.
They were making her like a zombie.
Oh, really?
They could type in or?
Yeah.
Yes,
I couldn't
yeah.
stay awake.
Oh, okay.
At all.
So I kind of stopped.
When did you stop taking them?
A few months. About July.
July-ish. Has that actually changed your mood though or anything?
No, it didn't really affect my mood anyway when I was on them. It kind of just made sure I had less of the mood because I was asleep.
She was put on them because you heard voices and stuff, wasn't it? And saw
Mhm.
things. You've still got the low mood, haven't you?
Yeah.
Have you still got the voices and things? Or?
Still got the voices, yeah.
Emily is a 17-year-old patient and she was under the child and adolescents mental health team for long-standing depression, but also she had been hearing some voices as well, and therefore she had been prescribed an antipsychotic. She also was being planned for an assessment for possible autism.
I mean, Em actually said that she knows they were the wrong thing for her, but she
I
needs
tried
to
them
be on
again.
something.
Like I stopped for a while, then tried them again to see if they were.
They just zombified her, and it was, well, we lost her totally.
Are you still under the...
She's just coming up to 18, they will chuck her off the system.
Oh, God, yeah, quite soon, actually.
I know.
So there is an assessment being planned?
There is, but I think the time it comes...
Do you need a transfer to the adult services, or does
they
that
do
happen
that?
automatically from there?
Well, Emily's really worried about this.
I haven't talked about it with anyone. No one's talked to me about it.
Yeah.
But also the diagnosis you were talking about, that's like a child's diagnosis. So by the time I'm an adult, it won't really matter.
It's a massive worry for Emily that she's going to be chucked off the system.
Yeah. And have you got a follow-up appointment before you turn 18, or...?
I'm going to ring them. She needs an appointment because really, even just coming off antipsychotics like that is not ideal.
Mm-hmm. If a patient gets caught in limbo between the child and adult mental health services, there is a risk of damage to their mental health, particularly because they may lose the continuous patient contact and consultations, they may run out of medications, and therefore we try not to let it happen as much as we possibly can.
Try and rearrange that appointment.
I will. I'm going to bring them today.
Do you want me to give you a call in a couple of weeks just to catch up and just...
That'd be great.
If you could find out if they can automatically transfer you to the adult mental health services or whether we need to do a separate referral.
That'd be
if you find out...
Okay.
Just put you down for a telephone call. Is that all right?
Lovely. Thank you so much.
All right,
for
no worries.
everything.
I'll speak to you in a couple of weeks.
Yeah, thank you so much. Bye-bye.
David Smith. Hiya. Thanks for waiting. Come and have a seat down there. How are you?
The reason I'm here today is embarrassing and it's humiliating. Last week, I took my wife up to Coventry. There was a problem on the M1 on the way up. Traffic was at a standstill. For half an hour, I didn't even move. I was desperate for a pee. I had to get out of the car, stand by the door with a van behind me, cars all around me, and pee on the motorway. That's what I had to do, and I just shrugged at everyone, went, you know. So what? And that's what I had to do, but that is bad. I'm 68 years old.
I used to see you for the prostate side of things.
That's
didn't I?
right,
And then we tried a few things, and then you ended up going under the urologist after that. Is that
That's right, yeah. I mean, that went on for years, though, you know. I mean, since then, I've had the gallbladder out and all that last year.
I just want to remind myself.
I don't know what's going on here, but it's totally, well, it's unacceptable, you know. To me, it is. You know, 60-year-old man peeing himself, you know. I mean, it's just not clever. When I feel it coming, I've got to go immediately.
So how long has this all been going on for?
For a while now, you know. No one is more meticulous than me about personal hygiene. I hate it.
When they tested you last time, they found things like tightening, what's called a stricture. So they found a tightening along the way that might have been part of the reason you were getting symptoms. They tried to rectify that by opening up the bladder, the opening of the bladder into
That's
the...
right, yeah.
And they also tried to dilate the...
I remember them doing
ureter, So they tried to do that to try and make things better. So I wonder whether it's actually worth referring you back to them as well, rather than me messing around with medication.
Okay.
However, what we could do... What we could do is give you medication to try and deal either with the prostate or the bladder while you're waiting for that referral. So at least you'll have done some of the steps along the way.
That may be helpful.
And doing your bloods and the PSA and all that stuff as well.
Yeah.
So I think that's probably the best thing.
Okay, I'll go with whatever you say.
Referrals.
I said to my wife, jokingly, I'll probably end up wearing adult nappies.
While you're waiting for the referrals, if things change or you're worried, come back to me.
Okay,
One of us.
Right, thank you, Doctor. Okay.
Take care, right.
Thanks a lot.
See
Thank
you.
you.
Bye.
Coffee, no sugar.
Tea, white, 2.
Tea, 2 sugars. Does Charlotte want one? No? Who didn't empty their cup?
There was no need for that.
Sorry.
Have a seat.
Chris, I got myself in a mess. Right, my list. I'm in a mess.
Are you?
It's this foot. I came down the stairs, the last 2 steps, for some unknown reason, I just took off and landed on my feet. I lasted that night.
So you didn't actually fall?
No, I was on my knees.
You did, like...
Next day, A&E. X-rays, they said no fractures or muscles and tendons. They gave me cream and tablets. So here we are. But the pain, Chris, is gone from there to here to here. Now, it's all gone stiff and the skin is tight. How can I get rid of it?
Should we have a look at it? Do you want to pop on the couch?
Yes, sir.
In fact, if you could leave your leg here, I'll have a look over the weekend and sort it out for you and put it back on Monday. Is that sort you?
Why not?
So this is the leg, isn't it?
Yeah.
So you say the skin is tight?
Yeah.
Does it just feels tight, yeah?
Yeah.
It's a bit swollen, isn't it, the leg?
Yeah.
It looks okay, though.
Yeah, we're
It's in good condition.
We're doing all right.
Yeah. It's not too tight, it's not too swollen. Calf's nice and soft.
Skin looks okay. So I know it feels tight, but it's more of a feeling than it because it is swollen. Yeah. Do you want to sit yourself up?
Please, sir.
Here we go. There we go. That's it. There. So the main thing is uncomfortable, isn't it? The whole leg. It's just going to take time.
Is it?
Yeah.
So what do I do? Leave it alone now?
Best thing you can do is keep walking, keep mobile on it, keep doing what you need to do.
No gel. Don't know if you'll understand this.
So the IV gel, that's good. So I'll tick that, yes?
Yes, please.
Naproxen, no. Put a cross by it.
No.
The cocodamol, no.
No.
Put a cross by it. But you can have paracetamol.
Yes.
Yeah?
I've got some of them.
OK, so I'll write it down on here for you. Elderly patients, like lots of patients, are sometimes lonely, and the general practitioner is there as a friend that they may have known for many years and someone who is easy to have a conversation with. And I think lots of people find it reassuring to be able to talk to their GP about the ups and downs of life. This is one of the functions I think that GPs provide really successfully for patients.
Oh, dear, here we go.
You're doing well.
Yes.
And you're looking well.
Yeah, do you reckon?
I do.
People say that, but...
I do, yeah.
Anyway, I'll let you get on with these other people.
Nice to see you.
Thanks, Chris.
OK, I'll see you 2 weeks' time. OK, I'll send you the appointment. It'll be Friday morning. OK, take care. Have a good day. Bye-bye. Bye-bye. Do you want to shake hands? Bye-bye. Oh, it's lovely, yes.
Right, cheers.
OK, hope you feel better soon.
Okay, see you later.
Take care. There you go. All right. Take care. See you. Bye.
Bye-bye.
Bye.